Thank you. So this would be the first introduction a patient would have to the office.
That's correct. This is a reception room, and as you can see, Dr. Pruitt was trying to accomplish something that was a very relaxed decor and something very comfortable for the patient before they go back to the clinical area.
Beautiful room.
We have all the multimedia things here. Businessmen can sit and check their emails here. There's patient education in the right-hand corner, yes, and then TV that's cable ready and DVD ready.
Okay, fantastic. So then they would wait here for a very short time, probably.
For a very short time. And this is the first thing that the patient sees when they walk through the door. And it's not just a series of cabinetry and equipment, and so the patient can see firsthand what he's trying to accomplish as far as infection control.
Sure. Well, there's no doubt that any patient walking into this area would know this was an important part of this practice.
So you can see, Dr. McCracken, this is a state-of-the-art inspection control system. When one of the clinical assistants comes from the operatory area with a contaminated tray, they push this lever. It's placed in the sterilization staging area, and then the door is closed. So the red light indicates that we have potentially contaminated instruments in the system. So after there's a number of trays that are deposited here in the storage area. They remove the trays. Then we go into the ultrasonic cleaner, and the cassette is cleaned in the ultrasonic cleaning solution. And the nice thing about that, we don't have to separate the cassette, change the instruments, individually handle the instrument. What we're trying to accomplish here is for the assistants to not handle the potentially contaminated instruments as least they possibly can. So we clean them in the ultrasonic cleaner, remove the tray. Here we have touch, water, we rinse the cassette.
Okay.
And shake dry.
And this item in the back?
That's an air gun. So if we needed to spray the cassette off, we're allowed to. It enables us just to dry the cassette off a little faster. Then we come over here, and then this is a cassette drying system. We literally put the cassette in the dryer, close the door, push another button, and then that cycles for about 2 minutes, and it gets the cassette dry, because we really want, since we're using steam sterilizer, we really want the cassette as dry as possible. If we didn't have the automatic dryer, we would literally have to stand these up on their end and let them drip dry, and that's going to take longer. The object of this system and concept of sterilization is to turn these cassettes over in a timely manner and get them back to where they could be used in the operative area.
Super.
And once we come out of the dryer, we go right into the steam autoclave. And the autoclave, this is on a 30-minute autoclavable cycle. And then this also has a drying cycle. So once the cassette is autoclaved and then goes through the drying cycle, it's removed from the autoclave. And then the blue light indicates good or sterilized trays. And then the trays are stored here and ready for the next patients that may be coming after lunch.
And I see that Dr. Pruitt has his trays organized by procedure, which I guess would be your recommendation at this time.
That's true, because if we're doing crown and bridge procedure or composite procedures, and there again, that aids in sterilization and helping him keep just those instruments in those cassettes, and it helps the clinical assistants as they bring them back out of the clinical area into the sterilization area.
Right.
So literally, a doctor could have probably in the neighborhood of 30 or 40 cassettes. But bearing in mind that this system right here helps us get those cassettes sterilized and ready to go back into the clinical area.
What might the time of turnaround be like from the red cabinet to the blue cabinet?
Well, 30-minute drying cycle. We're going to cycle the autoclave through the ultrasonic cleaner for at least 10 to 15 minutes. So you're talking a total turnaround time of about an hour. But there again, let me talk about the concept of sterilization. We're not just doing one cassette.
Right.
This storage area over here is to accumulate a number of cassettes. So we're running, it becomes an assembly line procedure after that. We're running 3 or 4 cassettes. This will hold 4 cassettes. We can dry 4 cassettes, and then we can also autoclave 4 cassettes at one time.
I really like the contaminated storage area, so you don't have these sitting around on a table somewhere just waiting to get into the ultrasonic. And I see you have a Statum over here as well?
Yeah, this is a Statum autoclave. This is really more for a quick sterilization cycle, hand pieces.
Right.
If the doctor has some particular instruments that he likes to use in the operatory that he doesn't have an abundant supply, then he can run in here, and this is a 6-minute cycle autoclave. So literally they can bring them in here, put them in here, and they're autoclaved in 6 minutes and brought right back to the clinical area.
And what about some of this cabinetry?
Well, the cabinetry is a laminated board, and if you'll notice that all the edges have a 3mm edge banding, so the wood is completely sealed. We would never have to worry about the material in this absorbing any infectious products.
Right.
This is a solid surface or a corian-like material here. There's no liquids or anything that will soak into this material. So everything here is staged for, is built for, sterilization and to maintain that sterile atmosphere.
So, and what would a dentist typically keep in this area?
Well, this is storage of burr blocks. We have sutures, surgical instruments,
okay,
individually bagged and sterile. Trash drop here.
Okay.
This is for general, non-contaminated, just paper towels.
Right.
And then in this area, let me show you here, this is the area where the biohazard is kept.
I see.
Once we eliminate the cotton rolls and potential 2x2, any contaminated products would go into the red bags, and then we have a service that comes by and picks up any biohazardous waste that we have.
Excellent. All right, so that's what happens with the contaminated cassettes and instruments and materials like that. Now, let's say we have a patient coming in. If we can move to the supply
Okay,
side.
so once the clinical assistants establish the schedule for the next day, in the afternoon, this is all the setup area.
Okay, so we're talking about a centralized area for materials.
Right.
I see a single-use disposable articulating paper.
That's correct. And if you'll notice, a lot of this is
throw it away.
unidose or single-dose uses item.
Fantastic.
So everything is staged here for the next day's work.
Right.
And then each patient chart is here, and everything is out of the contaminated area here. And then it's all taken into the dental operatory as the patients come in. So that's the first thing that the patient sees is the setup trays that comes up, and how nice and neat and organized they are as they go into the operatory.
And clean, because here's the sterile instruments right behind us.
Very clean.
So a clinical assistant would take the sterilization tray, put it on here, add, I see here, some anesthesia, single unit disposable suction tips, retraction cord, everything just goes onto this tray, and then that would just be disposed of in the operatory.
Right.
That's great. Okay, Randall, so this is one of the new operatory designs. I see you've got the very nice equipment in here. And something that surprised me the other day was when you said, well, you don't want your operatory too big.
That's true.
For sterilization reasons.
That's
Tell
true.
me more about that.
Well, what we've tried to accomplish in this day is an operatory that's about 10.6 or 11 feet by 11 feet, and this is what we've accomplished here. Because you don't want to get an operatory that's way too big, that you've got a lot of things to reach. And if you'll notice here that Dr. Pruitt has state-of-the-art, this is ADEC Preference Collections cabinetry. And this is the newest addition that's coming out of the ADEC Corporation. And if I could point out some things here, everything is a touch latch. So literally I can work it with my knee.
Right.
We're using a solid surface top for the same reason that we have solid surface in sterilization, that no materials or chemicals can penetrate this surface. And there again, the surface of the wood, we can disinfect all edges of the counters and the cabinets, wipe them down after a patient is here. Then for the convenience for the doctor and the assistants, we have glove and towel dispenser and two different sizes of gloves. So you'll see that in the operatory we have got the optimal amount of space, and we've utilized all the space. But everything is nice, neat, and tucked away. We have flush-mounted flow meters here, so flush-mounted flow meters allows us not to have a lot of things coming out of the cabinet,
Right.
anything that's potentially that could be contaminated. Out of the cabinet here is the rubber goods and the
Okay,
ambu
I
bag
see.
here. So
Super.
there again, everything is stored, has its own place in the operatory, and it's stored away and out of the potential aerosol zone. But once I want to wash my hands, I just touch the cabinet door with my knee,
How about
and
that?
I can wash my hands. And there again, no surfaces that that we don't have to touch. The least surfaces we have to touch is better.
Great. All right, Randall, you got to tell me what these little socks are for now.
Well, this is basically the way the operatory is presented to the patient. When the patient comes in, obviously they're seated in the dental chair, but then if you'll notice, everything that has potentially that could be used in the oral cavity is covered with some type of protective sleeve. The syringe, saliva ejector, and HVE, even the curing light and the high and low speed handpieces on the dental unit. So the perception is there too, that once the office is prepped after that patient leaves, and then we put these fresh and new sleeves on here, those are left in place until the next patient comes in and they actually see us uncover these before we're used.
Again, no doubt, patient says, this is clean, it's going in my mouth.
Absolutely.
It's been clean.
Everything that we do in here is perception of sterilization. What are you doing?
Right.
And we're showing them what we're doing right here.
Now, after the patient is finished, then the staff would come in and just spray all these surfaces down, wipe down this material, wipe down the tubing and such?
That's correct. Everything that is potential of work surfaces is a hard surface disinfector is used on the corian top. The chairs are wiped and disinfected after every patient. So everything on this dental unit can be potentially wiped down and cleaned and prepped for the next patient.
Well, I see there's some headphones on, and my favorite show's coming here, so I'm going to have a little break while you move through the rest of the.
Well, this is another one of the features that we have in the operatory. We not only have computer data entry here, but we also have intraoral camera, and we have a patient education tape going now, and we can educate the patient. We can actually show sterilization tapes in there if we wanted to.
Great. Now, I know this is not part of sterilization control, but can we see the audio-visual room?
Absolutely.
This looks like a video central here.
Well, this video storage area, and if you'll notice that every dental operatory has the potential of a DVD player, a VCR, tape, we have cable television, we have patient education, the Casey system, and then if someone is real interested, then we can just put any type of movie that they want and bring that right into the dental operatory while the patient is having their appointment.
Now, am I going to have to pay extra for Gladiator?
Absolutely not. Absolutely not.
Okay, Randall, now, you can help me out with this problem I've been having, but it's the x-ray films. Because, you know, you take the film in our office, you put the film in their mouth, and then you take it out, you have your gloves on, but then you can't carry that into the x-ray processor, so then you have to take the film, disinfect it, take your gloves off. It takes forever just to put a film through the unit.
That's correct.
And you have something better, I bet.
Well, we have something new, and let me show you right in this room right here.
Great.
Well, this is something new from Gendex. It's called Denoptics, but it allows us to have films without using film. Gendex Denoptics system, and what it allows us to do, as you just well noted, that when you go through a film-based system, you have a piece of film and you have potential contaminated chemicals or hazardous chemicals in a processor that we have to dispose of. So this allows us to shoot on a phosphorus plate, which is disinfectable, and then we bring it into the low light room, and that's another thing we've eliminated is a film processing room, so we don't have the harsh chemicals that we had to deal with in the past.
Okay.
We bring it in, we insert the phosphorus plate into the carousel, and then it's put into the processing unit, and after about a minute it reads that phosphorus plate, and the film actually comes up on the computer screen and then is entered into the database. So what does that do in the dental operatory? Well, we're not carrying that wet or semi-wet film back into the dental operatory. There again, we're not handling one more thing. The doctor recalls the film on his database in his operatory, and the film comes up for the patient's viewing on the monitor, or it can come up at 12 o'clock so he can view it, do his diagnosis, and then enter his treatment plan right into the computer at that time.
It's really nice. Does it use less radiation?
About 2/3 less radiation than normal film base.
And of course, for infection control purposes, you have the advantage of having them in these protective sleeves.
Little disposable sleeves.
So as the dental assistant just showed me, you take the film in the mouth and you can open this up, dump that onto the tray, bring it back with your clean hands.
That's it. And there again, that's one less thing that we have to process with hazardous chemicals.
That's nice. Randall, thanks very much for bringing us through. You did a great job here.
Thank you, Dr. McCracken.
I've got to go see my movie now, get my teeth cleansed.
Okay.
I'll be in here.
Great.